the same thing.
During the 1960s, heart disease was on the rise in the U.S. What doctors commonly call coronary artery disease is usually caused by a condition of the arteries that supply the heart with blood. What happens is that over time, a fatty substance in the bloodstream called cholesterol builds up in the coronary arteries, restricting the blood flow to the heart. This can ultimately cause several problems, from severe chest pain called angina to heart attacks. Cholesterol is a natural substance produced by all animals, including humans, and it's an essential component of our cells' walls. But when we consume dietary cholesterol, which is only found in animal foods like meat, eggs, and dairy products, it tends to stay in the bloodstream. This so-called plaque is what collects on the inside of our blood vessels and is the major cause of coronary artery disease. In the late 1960s, a colleague of Dr. Esselstyn's at the Cleveland Clinic made a major breakthrough in the treatment of this condition. In fact, Esselstyn shared space with him in the clinic's surgical locker room. His name was Dr. Rene Favellaro.
Rene really sparkled in the operating room, and in 1967 he did his first bypass graft at the clinic, coronary artery bypass graft.
This revolutionary new procedure was accomplished by removing a vein from the patient's leg, then stitching it on the heart's blocked coronary artery to allow the blood to flow around or bypass the blockage. Today, over 500,000 Americans go under the knife annually for heart bypass surgery, costing around $100,000 apiece. These operations alone constitute a staggering total of nearly $50 billion. Dr. Esselstyn also discovered that in the early 1970s, the risk for heart disease in rural China was 12 times lower than it was in the U.S. And in the highlands of Papua New Guinea, heart disease was rarely encountered. The link he noted between all the areas he studied was simple.
Virtually, the Western diet was non-existent. They had no animal products. They had no dairy, no meat.
Even more compelling to Esselstyn was some historical data that had long been overlooked. In World War II, the Germans occupied Norway. Among the first things they did was confiscate all the livestock and farm animals to provide supplies for their own troops. So the Norwegians were forced to eat mainly plant-based foods.
Now we look at the deaths in Norway, just antecedent to this period, from heart attack and stroke. 1927, 1930, 35, look right up here, right at the very top, 1939. Bingo! In come the Germans. Immediately, 1940, wow, 41, 42, 43, 44, 45. Have we ever seen a population have their cardiovascular disease plummet like this from statins, from bypass surgery, or from stents? No. But look what immediately happened. With the cessation of hostilities in 1945, back comes the meat, back comes the dairy, back comes the strokes and heart attacks. I mean, it's such an absolute powerful lesson. But we didn't get it.
Because of evidence like this, Dr. Esselstyn was making the same assessment that Dr. Campbell was due to his work in the Philippines. While Dr. Campbell was publishing his China study, Dr. Esselstyn was getting some powerful data from the research he'd started in 1985. He began with 24 patients, but 6 had dropped out in the first year, leaving him with a total of 18.
At the end of 5 years, we had follow-up angiograms, and 11 of the group had halted their disease. There was no progression. And there were 4 where we had rather exciting evidence of regression of disease.
These results were astonishing. The diet produced something that medication and surgery never had before: actual reversals of heart disease. The biological mechanism that caused these reversals centers on the lining of our veins and arteries, the endothelial cells.
They are the absolute life jackets of our blood vessels. You're young and you're a teenager, you're healthy. You could spread those out one layer thick and you'd have something that would cover 6 or 8 tennis courts.
In 1988, scientists discovered that endothelial cells manufactured the gas nitric oxide.
Well, what does nitric oxide do? Nitric oxide keeps our blood flowing smoothly without being sticky.
It also helps to dilate constricted blood vessels during physical activity and inhibits the formation of plaque.
And most importantly, nitric oxide is a powerful force for eliminating the inflammation that seems to go with this plaque.
However, scientific tests have demonstrated that when we start eating the typical Western diet, our endothelial cells are damaged.
When you're getting to be in your 40s and 50s and 60s and you've been slaughtering your endothelial cells, you don't have those 6 or 8 tennis courts. You may be down to 1.5 or 2, and they can't protect you.
Yet according to Dr. Esselstyn, when we begin eating a whole foods plant-based diet, the damage to our endothelial cells not only stops, it starts to reverse.
Talking to your doctor about ED may be the last thing you want to do, but it's definitely a conversation worth having.
I'm a practicing urologist and have been so for the last 25 years. And erectile dysfunction is actually the first clinical indicator of generalized cardiovascular disease. It's the canary in the coal mine. It's the thing that lets you know that you have some significant endothelial and vascular disease much earlier than will a heart attack or something like that. We have to stop thinking of the body like it's compartmentalized. It really isn't. The blood goes everywhere in the body. And so if you have vascular disease anywhere, you have it everywhere.